Medicare plan in 2017, this is important. If you're in the other room, you need to understand the deadlines and how they work. Now, Kalei, and I want to make this right, Ka'anoi?
Correct.
Yeah, and I want to say aloha to Sani Asa'au?
Asa'au.
Also, I want to make sure I get your names right because we're going to be talking about something very important. We love that Humana is here, and we want to know about this because Medicare, there's all kinds of information out there, but who is going to be eligible to switch that Medicare Advantage and the PDP plans, and when's that deadline to switch? Because it's kind of coming up, right?
Yes.
How's it going?
So we basically came off of open enrollment period that ended December 17th. So moving forward, we call it ROY, rest of year.
Okay.
And during the rest of the year, they have special enrollment period. So there's many reasons to be able to switch during the special enrollment period, yeah, the rest of the year. One of the reasons is if somebody is, they lost their coverage. So if they're involuntarily disenrolled, then they have a special enrollment period where they can go up to February 28th.
February 28th, got it.
This year. So that's the fixed deadline. And then you have some other people that have deadlines depending on their eligibility. So there's people who move out of state. When somebody moves from California, for example, comes to Hawaii, they have a time frame where they can have a special enrollment period. And then there's those that get extra help. So if they qualify for Medicaid, they qualify for special enrollments. And one of the big ones this year, in 2011, a lot of people continued working after age 65.
Yes.
So those baby boomers, a lot of them continued working, and this year they're going to be turning 70.
Yes.
So at that point, they have an 8-month period.
Okay.
To
Once
join.
they turn 70?
Yes.
Okay.
Or not once they turn 70, but once they they're coming out of retirement.
I see. And you know, the age of 70, 65 is a big deal, especially if someone's turning 65 this year, because there's information about that too. If they're 65, especially for that Medicare Advantage plan, right?
Yeah, so when somebody turns 65, they have a 7-month window.
Okay.
And those that qualify, if they have disability, if they're getting disability income for 24 months, then they have, they can be under 65 and qualify for Medicare.
You see how well knowledge right here, all the information. I'm so glad you guys are here from Humana because there's so much, but this is so important. Now, how does someone know, though, if their 2017 kind of plan didn't renew in a market, like if they're in a certain area, how do they know? Where can they get that info?
Yeah, so people whose plans did not renew for 2017, they should have been notified by their plan about these changes by October 2nd of 2016.
Okay, so they should know about that already. Yes. Now, what are some of the considerations for those who are eligible to switch from the Medicare Advantage plans when they want to choose a new plan? You know, because, gosh, there's selections out there, right?
Yeah, so there are several factors that they should consider. First of all, the cost. They should learn about what the cost will be, the premiums will be for the new year, or for this new plan. And then also the cost to use the plan, the deductibles, the co-payments, and also the maximum that they would spend out of pocket in case there is a catastrophic illness or a serious health event. That's usually called the maximum out of pocket. Also find out what the doctors or hospitals that are in the network for that plan. And then also, you know, review your records, your health records from the past year. You know, find out how much you spend on health care, and then also what you anticipate to spend.
And that'll help you pick the right option for you.
Exactly.
Now, that's a lot of information, but if anybody wants more information, especially about those Medicare Advantage plans, I mean, where should they go? I mean, can I call you?
Absolutely. They can, if they want to learn more about the Medicare Advantage plans, they can go on the Medicare.gov website, which is the official Medicare website. They can also call 1-800-MEDICARE. They're available 24 hours a day, 7 days a week. And viewers can also go on Humana.com. Humana.com/Medicare. They can call our Honolulu office, our local Honolulu office at 808-540-2570.
You know, and I was on your website looking a lot at it, and we'll have all the information links. But real quickly, I want to ask how you guys, when you feel, when you get the phone call and someone's you can hear the desperation in your voice and you walk them through it and you help them out, how does that make you guys feel? Because there's so much information options, but it's something that we all need to do and take care of, right?
Yeah, so I like to call it glorified social work. When we help people, you get that intrinsic value. You're able to help them. And a lot of times you leave a member's home and they're they're saying a prayer, say thank you God for bringing clay here, or salespeople, and they really appreciate it.
Well, I appreciate you guys. No, thank you so much.
Yeah,
Because
thank you for
seriously,
having us.
This is an important thing, and again, those are a lot of deadlines, a lot of information, but we have that on our website. We have links there. But when you have people like Humana looking after you, it kind of makes you feel good inside. Thanks, you guys.